very, very important topic. We're going to talk about sedation. We're going to try to make it short as possible. Okay. So people ask, what kind of sedation do you offer when you do those full mouth implant procedure, right? So our basic level of sedation is oral sedation. Oral sedation is you take a pill the night before the visit. You take a pill an hour before. We'll give you another one. You're pretty sedated and you're fully monitored just like how you would with any other sedation, but there's limitations to it. It's simple. It's good for simple procedure, maybe veneers, maybe crowns, maybe you're doing some dental work that you just need some simple sedation. Our golden standard is IV sedation. IV sedation is, and I perform my own IV sedation a lot with my procedure. IV sedation is basically, making sure you're fully clear for the procedure, you're medically healthy, and if you need full mouth implants, so basically you're going to get a couple of pills before your visit, so you're pretty sedated, but then I'll be putting an IV in the best vein in your hands, in your arms, in either here or here. And obviously we're going to be putting medicines in our media, and you're going to be hydrated the whole time. So basically, I have a cocktail that I use to put my patients in a very nice level of moderate sedation to get the procedure done. And people that have had sedation done by me, they can vouch for that. And it's a very comfortable. Patients are they're at ease. And not only we manage anesthesia, but we also do pain management. Patient asks me, am I going to be in pain during the procedure? No, you won't. Because not only we're going to do good local anesthesia, surgical grade anesthesia, but we're going to do a really, really good level of moderate sedation to make sure your blood pressure is good, your heart rate is good, and you're going to be really, really nicely sedated to get the implant, the veneers, a whole bunch of implants, like extensive dental work that you normally would put it off. So that's our gold standard. Now, you go to the higher level. Well, general anesthesia. We offer general anesthesia. General anesthesia is basically you have an airway, most likely in our case, a nasal endotracheal tube down the nose because we got to work in the mouth. And that's our anesthesia partners, our anesthesiologists, MD anesthesiologists. They're very, very well versed. They'll do a pre-op evaluation. If you're a candidate for general anesthesia, and somebody asked me why general anesthesia, who would be patients that need general anesthesia? They may have other health issues. They may have other comorbidities. Their monitoring requires general anesthesia. They may require some anesthetic gas. They may require a very deep level of anesthesia for very complex, like for example, zygomatic implants. Some, not all, because we've done zygomatic implants under sedation, but general anesthesia requires some very, very complicated, complex medical history as long as you're a good candidate cleared by your medical doctor. So we offer a wide encompass array of sedation from basic end of the spectrum to the most advanced end of the spectrum to make sure, most importantly, what is the outcome? Patient is comfortable, patient gets the care done, patient does not need to put off care, and patient doesn't have to be fearful, because 50% of the patients, you guys don't go to the dentist because of one bad experience. You've had a tooth pulled that you were numb, you've had anesthetic that didn't work. But with our surgical concepts, with our anesthesia concept, rest assured you're fully taken care of by my team and I to give you the most pleasant and the most amazing experience, so that way you can get the care done. Give us a call and get back in here for a consultation. 312-951-8338.